think it's quite fair to say that the amount of confusion and uncertainty that has been created by Brexit is having an impact on people's mental health. People worry from a health perspective about whether they're going to be able to get access to their medicines. And while we know that there are good processes in place so that they will be able to get access to their medicines, it's still a worry to many people. People worry about their jobs, they worry about what might happen to their business, what might happen to their homes, whether they're going to be able to continue to live where they want to live, access healthcare where they want to. And as well as that uncertainty, I think that the divisiveness of the discussions at the moment also risk increasing the prejudice and discrimination that could be happening around the country. And that is a known risk factor for mental health problems. So I think that those things are really contributing to an increase in anxiety and potential increase in the demand for mental health services, which could, of course, be challenging because we also know that Brexit may impact the number of workers available in the health and social care sectors. So actually an increase in the need for these services could be challenging in the case particularly of a no-deal Brexit.
A lot of people would love to see clarity, but assuming that we can't get that in the coming months because this process has dragged on for so long at a national level, what would you suggest that people do on an individual level to help them to cope with the feelings of anxiety and frustration caused by Brexit?
Well, I think it's reassuring, certainly from the health perspective, to know that we've had a really good look at all the plans that are in place, and I think that they are quite reassuring. So I think that from the perspective of worrying about the UK's preparedness, from the health perspective, we're in quite a good position. I think that from the other perspectives, we all just need to be a bit kind to each other and recognise that this is a challenging, anxiety-provoking, complex political situation. But really, we need to remember that this is just about people, and the health services are still there. The NHS is used to working through emergency situations and uncertain situations, and it does so with aplomb, and it will continue to do so. So while it is very concerning that we currently have this lack of clarity, which could be contributing to a lot of anxiety, at the same time, there are good provisions in place to keep everyone safe and make sure that the health service in particular runs as normal.
So you've outlined a number of factors there, but there is a lot of anxiety because this process still isn't over. And I think one factor that perhaps is causing a lot of people frustration is the fact that they feel that they have no control over this process and they're having to rely on politicians that they're losing faith in.
Well, I can really only speak from the health perspective. And from our perspective, I think that there's anxieties that people are not in control of the various things that could affect health, things like medicines, things like research, things like access to medicine, public health, workforce availability. And all of those things are being looked at, certainly in the case of a no-deal Brexit, to make sure that patient safety is going to be prioritised. And certainly the UK is really working to make sure that patient safety will be prioritised, but that is a two-way street. And the challenge is that while we're waiting for all these debates and agreements to come to pass, we don't have those bilateral agreements that will safeguard patients throughout the Brexit process. So I think that a really big priority here is to get a bit of clarity so that people know where they are, so that we can reduce the causes of anxiety that come from the many, many parts of uncertainty around the Brexit process, and enable people to make good plans to keep patients safe, to keep health services accessing what they need to deliver the world-class service that we do.